Tuki, greva Tuki. Tuki greva Lizi. Tuki, Liza, prosim te. Ja, Still in industrial zone. So, and yeah, you can see the quartet, the new buildings that are going up, new couple of hundred people moving in. So the most problematic is how the money comes from so-called health chess, which is financed through your healthcare participation, comes to the healthcare system. And because this chest, we will call it chest, it's administration, or it's run by administration. So administration for every single year in advance announces how much of healthcare procedure it will cover, so how much it will pay. So for example, in the year 2023 we will cover the cost of 1,000 open chest surgeries, 100,000 broken bones, and so forth. I think that you know what I mean. So they are still living in the era of planned economy, that the state can dictate the all all views, parts, aspects of living. Ja, ne moreš noter. Pridi. And of course this means that doctors, and this also affects the primary level of healthcare. We have doctors that can treat, but they cannot treat because their procedure or pills that they will prescribed, they will be not paid through your health chest. And this is also the reason why a lot of people are leaving public sector and going into the private sector, where you have to pay everything for by yourself, but they are then able to provide better health care because they can do everything that they need to, and don't worry, and they don't have any worry if some bureaucrat will approve this procedure. You have similar problems with in America with private insurance companies. We have problems here with the state-owned entity which is in charge of financing the healthcare system, which you of course have to pay through your contributions. And so for example, you have, if you are male, you have 2 doctors that you have to declare. Well, you can declare. So family medicine doctor, physician, and a dentist. Females also have gynecologists. So I am currently declared in public dentist, and of course also I have my own declared family medicine physician. But for example, and I also go to private dentist, which I pay everything myself. And my private dentist used to work in public sector. He was actually, at some point, he was the head of the dentistry surgeries of all the dentists in one of the local health center. And he said he left because he couldn't provide all the treatment that his patients needed, plural. You know, he said, yeah, when, let's say, a patient came in, he diagnosed, you know, what is the problem, you know, root canals and so forth. According to the rules, you know, during one visit, he only could fix, you know, one tooth or fix one problem, because, you know, they work on some kind of point system, you know. For every visit, they can use so much points for each patient. And then, you know, when he so which meant that he had to, you know, he would be able to do everything in, let's say, one or two visits, you know, but in these cases, he needed to schedule his patient for several visits. And of course, that would also, you know, limit his time to work on other patients, because every time he would have to, you know, let's say once per week, he would have to schedule one patient for several procedures. And of course, he said the problem was also the quality of the material that they had to buy, which was a lot of time overpriced. You know, we have a lot of, several years ago, there were, of course, media discovered, let's say, that in Slovenia we are paying much more for the stents, you know, for your, let's say, artery, your blood system. You know, if you have what is it? I will not now remember what it's called. When, you know, the, let's say, artery expands and then can burst. Something on A. So, you know, you need to fix the artery with, you know, the stent. And we were paying, so the system, public system, was overpaying for this material several times more than the same material was paid for in, let's say, Germany. And, you know, if you are losing material, money on such material, you know, you are losing, hemorrhaging money everywhere. And yeah, but of course, you know, when there are people connected in some way to political option, this will continue on, no matter what because let's say these suppliers are smart, and they support both political options. Well, we have left and right, if you consider, and then you have a lot of political parties inside of the options, and and then physicians are overworked and at the same time cannot work as they could or they want to work. Money is going out from the system where it shouldn't go. Bureaucrats are determining what they will pay for. You cannot control life. You cannot predict how many people will break their arms, legs, have heart attack, needed surgery, need treatment due to the cancer. You cannot predict that. But until this, system will not be changed in its entirety, this will just continue on. And our politicians, don't have, let's say, motivation to change the system. Even, in every election we are hearing how they have plan and so forth and what they will change. So, for example, this current government that we have is left of center. Okay, Liza wants to go forward. Of course, when there were elections, they were saying they have the plan, we will do this and that, we will need them, we will do this, and it will fix everything. They started their term in June, July, in the summer of last year, and now they have declared that currently they are still working on a plan, on a solution for the problem, even though before election they had the plan, apparently, what to do. And this solution, which of course nobody knows what it will be, well, there should be a host of solutions. They said, yeah, we will present this case, in 2024. So more than a year and a half after the start of their mandate and their term. And term lasts for 4 years. And of course, so their temporary solution this year is basically just throw the money into the system and see if that will work. But if the doctors are leaving the public sector, there is no money to throw at, because no one wants to work there. And those that are still working there are tired, exhausted, and nobody's listening to them. And yeah, another long rant regarding situation in Slovenia. But we have new buildings, the quartet and those two, plus not to mention Celovški Dvori, so this whole complex that was built in the last 2 decades. But in this time, no new schools were built. There were a couple of new additions to the kindergarten system here, some additions, so they expanded it for a bit. But healthcare, nothing. Even worse, people left it to work in the private sector or they retired. And yeah, basically This is it.